Hello everyone. Today we are going to speak about a very important topic which is quite getting common nowadays, and that is known as blood cancer or leukemia. Now what is leukemia? Basically आपके जो bone marrow, which is a soft tissue in the long bones of your legs or thighs or in other long bones of the body, usually that have a small soft tissues in their center, which is a precursor in the formation of various blood cells in your body that are important for all the body functions, such as the red blood cells, white blood cells, platelets, and other kinds of cells that form various other body organs and tissues. Now, whenever there is an abnormal production of the WBCs or the white blood cells, or there is increase in their size and number, this can result in basically leukemia or blood cancer as it is called. Now, what are the signs and symptoms of blood cancer or leukemia? Usually, the patient starts getting weight loss or weakness or fatigue in the initial stages of the disease, which becomes frequent with time. As the time passes, these conditions become more frequent. कुछ पेशेंट्स के अंदर इन्फेक्शंस बहुत ज़्यादा होने लग जाती हैं. कई टाइप की इन्फेक्शंस दे सफ़र फ्रॉम, लाइक फीवर्स, रेगुलर फीवर्स हो जाएंगे, चिल्स बहुत रहती हैं पेशेंट्स में, ट्रेमलिंग हो जाती है कुछ पेशेंट्स में, मसल्स की इश्यूज हो जाते हैं, मसल वीकनेस डेवलप हो जाती हैं, एंड विद टाइम दे बिकम मोर सीवियर. इसका कोई कारण पेशेंट यूजली नहीं बता पाता है कि क्यों ये हुआ, या उनके पास कोई पास्ट हिस्ट्री नहीं रहती है कि हाउ दिस कंडीशन हैज़ बिकम मोर. Then there is another thing that is important is that patient develops small, minute, red pinpoint spots on their skin, which are commonly known as petechiae. These are basically the bruised or injured blood vessels that are present just under the skin, and when they rupture, they cause these pink reddish white spots that are dot-like structures under the skin. Besides that, they may also develop frequent fevers and infections, and also they may have issues with lymph nodes. So lymph nodes are basically the nodes that are present in your neck, the cervical region of the neck, in the abdomen, under the armpits, or in the groin region, and these usually get swelled up when the patient has these frequent infections. सो इनकी लम्प फॉर्मेशन स्टार्ट हो जाती है बॉडी में, और जब ये होती है द पेशेंट यूजुअली suffers from swelling of these lymph nodes. Besides this, patient may also have general malaise, or they may also develop fevers and other issues, like if there is involvement of the various organs of the body, such as liver is involved. They may get issues with skin issues, constipation, and other problems. Also, they may develop enlargement of the spleen in some cases. And gradually, when these lymph or the blood abnormal blood cells travel to different parts of the body, which is known as metastasis of the blood cancer, and they get involved in various organs of the body, then if the growth of the blood cells occur on those organs, then they may cause pressure on the adjoining organs and structures and result in various symptoms according to the part which is involved. Now, if we talk about the types of leukemia, usually they are classified into two major types, that is acute lymphocytic leukemia and chronic lymphocytic leukemia. The acute condition develops very fast. Within a few days or weeks, the patient may become very severe, and if the treatment is not started immediately, immediate death can also result in such cases. This kind of acute lymphocytic leukemia occurs usually in children, and इसके अंदर जो basically जो cells involved होते हैं, they are the lymphocytes, which are type of white blood cells that help to fight infections in your body. Then there is another type, that is the chronic lymphocytic leukemia, and that occurs when the body involves the cells, they become abnormal, the lymphocytes, they increase in size and become cancerous, and when they increase in number, their disease fighting capacity decreases actually, and the body becomes more prone to infections. But since this is a chronic condition, this takes sometimes remains symptomless for many months or years even. Patient doesn't even know that they have this problem unless they start developing the symptoms of the disease. And sometimes this may remain in remission or latent in the body, and once the problem starts becoming more severe and the patient goes for various blood tests, only then this condition gets sometimes diagnosed. Now, depending upon the types, and this chronic type of lymphocytic leukemia is more common in case of adults. Now, let's come to how the diagnosis is made on this condition. The main diagnosis depends upon the normal blood test, that is the CBC profile. Then there are usually advanced tests of blood that are done to see the size of the various blood cells. In case of where the diagnosis is confirmed, that is only done by bone marrow biopsy or bone marrow aspiration. So basically in bone marrow aspiration, they take out some fluid or the blood from the bone marrow, and then they study it under the microscope to see the abnormal structure of the cells to confirm the diagnosis. And also for the biopsy, they take a tissue of the bone marrow from the by aspiration, and then they study it under the microscope to see if there is any growth of these cells or the stem cells they are getting decreased, or there is other conditions such as anemia, or there is another condition that is lymphocytosis or the other increase in other lymphocyte cells in the body, and these usually indicate towards this disease. Then there are also advanced tests that are done to confirm the diagnosis, such as the MRIs are done, or there may be other ultrasounds that can be done to see if the organs that are away from the bone marrow, like they have not metastasized the cancer into the other organs, and if that is done, that usually can go to the liver, to the spleen, lungs, to the heart. In some cases it may even go towards the brain and the spinal cord, and in those cases the cerebrospinal fluid from the spinal cord is taken, and then that is studied under the microscope to see any abnormality in the cells. So these were some of the diagnostic tools that are used to confirm the diagnosis of this leukemia or blood cancer. Now, homeopathy is important in the field of leukemia in this fact that it helps improve all these conditions. And if we can find out the various root cause of the disease as to why the disease started in the very first place, if there was any stress, if there was some life situation in the life of the patient that triggered this tissue increase or issues in the body, then that could result in basically formation of the this problem. So now what happens is that usually in homeopathy there are some very good medicines that can treat both the side effects of the radiation therapy and chemotherapy that is usually done to tackle this disease. There are some medicines such as radium bromide, or there is cadmium sulf or radium sulf that are usually given to the patient to tackle the bad effects of x-rays and radiation exposures of the patient. Then there are other medicines that can be used according to the symptoms and the psychology of the patient. Some of these may be like Natrum arsenicum itself, or there is other medicine that is Natrum phos, or other medicines that can tackle issues with the changes in the various salts imbalance that occurs due to this disease in the body. So it is important that the patient refers himself to a very good physician who tackles these problems by finding the various root cause of the problem itself. Then there are issues. The patient's lifestyle has to be managed in such cases so as to improve the immunity and the disease fighting capacity of the body. So that is a very important aspect in this disease. In case of acute lymphocytic leukemia that is occurs usually in children, it is very important that in case there is any bleeding occurring, such as commonly seen in children, those who have frequent nosebleeds or those who have petechiae or skin eruptions or boils on the body, or those who are getting frequent colds, coughs and other infections right from their birth. If these conditions are frequently occurring in a child, they should be sent for a common regular blood test to rule out any such severe diseases. And if those are found, then accordingly various therapies and supportive therapies can be used to tackle this problem. Homeopathic medicines, that have been mentioned before, can also be very useful to tackle the side effects of chemotherapy, X-ray radiations that are done frequently, and it is really advisable that the patient does not go for any severe operations or very surgeries until and unless their condition is under control. Sometimes it has been observed that the metastasis of the cancerous cells become more fast when the concerned organ or the bone marrow is removed or the spleen is removed in such cases, and when that occurs, the body as a compensatory mechanism starts affecting the other organs of the body. So these are some of the symptoms and the conditions that have to be dealt with in case of treating patients with leukemia or blood cancer. So this was a short informative video for information purposes only, and any self-diagnosis should be avoided in such cases as it is a very severe disease, and only a concerned physician should be referred and consulted to treat such conditions. So I hope you had some good information about this very severe form of blood cancer, and in case you enjoyed watching the video, please like and share with your friends and colleagues, and have a great day.